Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a self-myofascial release technique for the tensor fasciae lata, or TFL. The TFL is a hip flexor muscle that also helps to stabilize the knee through the IT band. When this muscle is dysfunctional, it can help contribute to inhibition or shutting off of the glute max, which will prevent the glute max from firing on time when walking and running. To achieve the ischemic compression component of this technique, we are going to try to identify tender areas or self-myofascial trigger points within the TFL and apply direct continuous force through the lacrosse ball for 20 to 30 seconds. To achieve the myofascial release component of this technique, we are going to apply direct force into the fascia in the area of the TFL for 1 to 2 minutes. To locate the TFL, we're first going to find a bony prominence on the top of the pelvic bone called the anterior superior iliac spine. So if you palpate the top of the pelvic bone on the front side, you should have a bone that pokes out in the front. That is your ASIS, or your anterior iliac superior spine. So the TFL is going to attach just laterally to that. So laterally means away from the midline to the outside. So if we move laterally or away to the outside from the midline, you're going to find the TFL. So the TFL, again, is a very short muscle. It's only going to occupy a space that's about this big. So maybe a 2-inch by 3-inch space. And that's what we're going to apply our force. So first we're going to locate that bony prominence on the front and top of the pelvic bone. So once I locate my ASIS, I'm going to take the ball and put it in that meaty area just to the outside or lateral of that bony prominence. So now I'm going to take the ball and I'm going to push it directly into the wall and try to locate a myofascial trigger point or tender area. And once I locate it, I'm just going to pin it down for 20 to 30 seconds or until it becomes less intense. Right? And then when that area becomes less intense, I'm going to move the ball superior or inferior and left to right until I find another tender area, and I'm going to apply force into that tender area for 20 to 30 seconds or until the discomfort again becomes less intense.